The Brighton-Lusaka Health Link partnership has mostly focused on strengthening or championing the role of pharmacists in antimicrobial stewardship.
We had 6 pharmacists travelling to Zambia to see what projects could be developed, and we had another 6 pharmacists from Zambia coming to Brighton to see how we provide the service and could we learn from each other.
The other aspect that is of public benefit at the moment is we're trying to strengthen as pharmacists our role in infection prevention and control. We're able to provide certain services such as production of hand rub, which is used for infection prevention. So by providing such commodities for use in infection prevention, we're able to ensure that the public who access our hospital facilities are able to sanitize and be able to operate in a safe environment.
If it were not for this project, government wouldn't have been able to sustain the demand for the commodity, and even the cost itself wouldn't have been sustainable for the institution itself. So it has benefited the health workers because they're able to use this product and prevent the spread of the pandemic, mostly the COVID, which is ravaging this nation and the globe.
With our experience of facilitating a hand rub production at UTH, we realised this can be done in the UK. We went to the University of Brighton to see if they could produce the hand rub for the local hospitals, and thanks to the hand rub produced in this pharmacy lab, we managed to plug the gap.
Could we make hand sanitizer in litre quantities? We looked at the WHO specification and decided that yes, we could. It took us 2/3 to a whole day because there are so many checks and balances we have to do because this is being used in healthcare, but we did. We made litre quantities of hand sanitizer, which we delivered to various sites within the local NHS trust.
The hospital is managing. It's like it's a cut on the budget. They're not really spending much. Yes, the expenditure is there, but at least I think it's been cut by 50%. So it's really helping us. We've got adequate supply of hand rub.
Other institutions, the small hospitals, they've learned that UTH is producing hand sanitizer. So they bring their raw materials here and it's being done for them.
Now our desire is to cascade this initiative to the provinces, and if there will be resources, even to the lower levels of the healthcare system, because this is something that can be done. Especially that we have qualified pharmacists or pharmacy technologists in these hospitals. So we look forward for more partnership.